The other one, golf ball, rolling for foot for plantar fasciitis. And I say this from a clinical perspective over many, many, many years. The golf ball is the best tool for plantar fasciitis, aside from home care, dietary, and other lifestyle factors. The golf ball is excellent. When you use it, you want to step down on it. Do not grind it. Just let it push in slowly for about 30 seconds. Step a little harder so it pushes in more, and a little harder, so about at a minute, it's pretty much released what it will. Unload your foot, roll very gently to find another spot, and then step down again. 3 to 5 places per foot, slowly trigger pointed like that, will let the tissue derange, elongate, and let the circulation come through. Rolling hard friction with a golf ball will create plantar fasciitis. So it's on a personal, emotional note, there's nothing worse than somebody who's diligently been grinding the daylights out of their foot to take care of their plantar fasciitis, and it's worse. So that's why I say educate, experiment, reassess, change. Things that are puffy and sore don't like grinding, they like stretching. And the golf ball is a great one, about the size of your thumb, to just gently push in there and stretch to open up that tissue that's locked. Before I move on to checking a couple things, how many people have been to massage therapists before? Okay, excellent. How about acupuncture? Great. How about chiropractic? Okay. So 8% of the population in America uses a chiropractor. Right now, I'm thinking you're about 15% of you raised your hands out there, and it's not a highly utilized business, but I'm going to show you a couple things as a chiropractor, what happens when somebody comes into the clinic. And I'm going to use Nancy here as a stretch. You'll see some of these stretches, and I'm going to explain as I do these what we're stretching and how to do some of these on your own. Let me lay on your back. And Nancy has come up. I'm going to go through. Yes, please. Duct tape this on my neck. I want to show you some of these stretches because there's a lot of good healthcare practitioners out there. And if you've seen something that's different, that maybe you get help from somebody and you don't need, this is not anything super special, it's just basic. And then sometimes, I'm guilty of it too. I get in a clinic, I know what the person had or has or something, and that's why I say always ask questions, because they need to stop me and say, it's different and I need you to look at this, or can you do this for me? I'm really receptive toward that, and I encourage you, if you get help from people, ask them for help for what your specific needs are. So a couple of these stretches, this is when somebody comes in with a low back, they're a leg athlete, walker, runner, and there's a high lot of usage, that's great. Can you edit that?
Yes.
Okay. There's a high output from legs, not so much from shoulders, and not a whole lot from the spine. Here's a quickie stretch, and you'll see us doing this to people over on the tables. This preloads the piriformis muscle right in the hip. And when people talk about a deep hip pain, to rotate and get this hip stretch, this will feel just like a pencil's going into the hip socket. This is the one when you're out after many miles and you can't quite figure out how with a curve to stretch this. This is how you stretch it. I can tell by Nancy's smile, she loves it. she's in that happy place. And I'm gonna just kind of demonstrate the positions here so you can see this. And then we switch sides. And this is a stretch. This is called passive stretching, where she's not doing anything except letting the tissue release. There's another form of stretching called and breathing. Yes, proprioceptive neuromuscle facilitation, PNF for short. If you say PNF, a person that can do it will know what that means. And then I'm going to switch. That stretches this buttock region, and now I'm going to stretch the quad. So placing force down here to make sure that her sacrum stays flat, and then stretching this way will get the quad stretched. PNF stretching involves 2 to 3 sets of high resistance by the person being stretched, and then a quick uptake to further stretch them. You need to be warmed up, and also having somebody do that with you is very helpful. If you want to try PNF stretching, we do that at the tables. Post-exercise is the time to do it. Switch. And this one's looser. Can everybody see how easy that foot just comes right up to her buttock? Versus this one, we get about right here, and then I have to start to force it. So right there's good feedback. This one just drops right up. This would create some torquing, where Nancy and I will talk later about how to correct for this. But that will create some torquing when she's out there running, trying to use both legs equally. One side's ready to do a little bit more work than the other.